Thank you to all of you for being here today for what is certainly such an incredibly important conversation. And thank you so much, Dr. Godrej. I can't see her as well right now. It's very difficult to see anyone from here. But for those words to start off with. As we begin this conversation, I think it's important to acknowledge that India, like the world, faces a mental health crisis. Nearly 1/3 of the world's global sort of cases of depression, of suicide, of anxiety are in this country. 20% of Indian adults require intervention in some way, shape, or form, given the status of their mental health. And in 2017, 200 million Indians required mental health care of some kind or the other. Now, these are big numbers. These are a lot of statistics. But behind all of them, behind this crisis, is an epidemic of loneliness. Across the board, Indians, especially young Indians, are lonely. They're feeling more alone today than they ever have before. And of course, there are numbers to back this up. There's a 95% gap in terms of the mental health care access. There's also the abysmal number of 0.75 psychiatrists per 1 lakh Indians and 0.07 psychologists. This is all numbers that Neha has very graciously sort of provided me with, but also done the important work of uncovering. But beyond all of that is this feeling of being in something that does not have a solution, that does not have space. And I think I want all of us to sit with that feeling as we begin this conversation, because it's easy, and I was very tempted to go into a space that made it a very technical conversation as well when I initially was asked to moderate this panel. But it's important for us to sit with that reality of that loneliness, of what it really means to confront a crisis of this scale. And to that end, Devika, I want to ask you, because Devika is a movement practitioner, to lead us through some breathing to prepare us for this panel.
So how yoga practitioners would generally go, they would say, oh, take a deep breath, feel your breath. But a lot of the neurodivergent me says, I'm always breathing. So I will not start with breath, but what I will start with is movement, right? So if we can open our chests a little bit, right? We're all tired after the day, but if we can find a way to sit in our seats a little bit gentler, open our chests to the opening of this conversation, which may be hard to hear, which may be insightful, which may scare us a little bit, that this is the system that we are surviving today. But just open your heart. And this is a song that I do with my neurodivergent children that I work with, which says, the rain falls down, the flowers bloom, the flowers grow tall, swaying. So if we can all just have a little movement, if we can have the rain fall down, metaphorically, and have all these conversations bloom in your heart, and have them grow and take shape in your body, and as we sway together as a community, the song ends with, the world is calm and I'm at peace. So if you can take a deep breath and really feel coming together here today to listen to this conversation and to be a part of this ecosystem. Thank you.
Thank you so much, Devika, for sort of grounding us in some ways in this moment. And thank you to all three of you for being such an important part of India's mental health journey today, where so many people feeling alone have recognized in all three of you, who are trailblazers, innovators, path breakers in their own right, recognition, solace, comfort. And I want to start off this conversation by asking all three of you, and maybe maybe because you're next to me, Kavita. Did you feel alone when starting off this journey? What prompted you to sort of do work that in many ways seems like it doesn't have space for expression?
That's my entire life story. I've always wondered how to answer a question like this, but we have a few words, and a little bit of time to compress the 52 years and the many layers of what happens inside each one of us. I don't know whether it was a singular event, or I think life builds on itself, throws things at us. It's about how we embrace it. So I grew up in a middle-class household in Delhi. My father's a doctor. He's 93 today. My mother had schizophrenia, but when I grew up, I did not know that she had an illness. She was just mom. This was just our family. I have an elder brother. And this was just us. He was the neighborhood doctor, and I grew up like that with oftentimes things that were unexplained, things that looked confusing, were very confusing for a 3-year-old, 10-year-old, 15-year-old Kavita, who was also trying to live her life in school, in the neighborhood, with friends, but also had moments of violence at home, moments when my mother would suddenly become violent, for what I saw as no reason, for sometimes not just violence, but a lot of embarrassment and shame, because neighbors who knew that there were voices coming from this house that shouldn't come from this house and wouldn't cross the threshold of the house to come in to help. They knew there were 2 children in the house, but this is how we live. There are certain things which are visible and heard, but they are made invisible by not acknowledging. But as a child, I used to need to go out every day to play, to cross that threshold, and go to school. As I grew up, I don't know how many of you would agree with this, there comes a time when you hate your parents. Sometimes openly and sometimes in your heart, and then you might grow out of it. So I thought that was what it was. I didn't like my mother very much during my teens. But once I went to medical school, I read in a textbook some of the symptoms of what was termed as paranoid schizophrenia. It was one paragraph in a forensic psychiatry textbook. I was like, oh, this sounds familiar. And I went home that day and I sat my brother down and I said, you know what? I think our mother has an illness. Look at this paragraph. He's also a doctor. He was a year older to me. He had already read all these paragraphs, or maybe not. Who knows whether we read all our textbooks or not. And he said, of course, she has schizophrenia. I know about it. Dad told me when we were in class 10th. This invisible conversation that nobody thought needed to be told to the younger child, who was 14 maybe at that time, and therefore didn't happen within the household. So these are the invisible spaces, I think, that I grew up in, knowing that nobody was talking about it and therefore internalizing that as a story that nobody talks about these things. In any case, at that point of time, I didn't have any words. I didn't know it was schizophrenia. But once I had the words, I think one part of my journey started, where one knew that it was not just mom. There was an illness attached to mom. And then started the journey of figuring out what part was mom, what part is the illness, is all of it? What part does one need to hide? What part of myself do I need to hide? Because in India, the way we grow up, we don't grow up alone. We are really attached to a family name and our extended family as well. So who knew about her story and schizophrenia and who didn't was another journey. Whom could I speak to? Or no one. And as I grew up, finished medical school, I wasn't very inspired by anything else except the human mind. And at some point, I decided to become a psychiatrist. So I would say that was the next phase, so to speak. And I had the privilege of sitting for hours and working with people who were called patients. But also because we worked in an inpatient setting, I often met with the carers, the caregivers, the families, who knew more than me about what was going on, far more, and would help me as a young doctor to figure out what best to do. Don't give this dawai right now. This is what will happen. Do this, don't do that. Don't approach him right now. Approach him later. And I realized there was a lot of wisdom in the evenings, not during ward rounds. So I think that was another thing that helped me in my journey. And eventually, I think as I grew up, one of the things that helped to lay the ground for co-founding Children First Mental Health Institute was, in my mind, one of the things I think I was still trying to help that little Kavita who did not have anyone to talk to and did not have a place like Children First to go to. So I think for many years, children who sat in front of me or families who came, I saw a part of myself, and I felt, I wish I had that, but equally I felt this needs to be done. So I think that has always been something that has inspired me. Children inspire me a lot. Young people inspire me a lot. I love working with them. But as we've gone along, I think the next phase of really looking at what India needs, and that sounds very big, because India is not one country and not one kind of sort of need. I think we all need to come together. There's a lot of strength in all kinds of wisdom, because mental health is in us all. I mean, I can't see the hall, but if I can request, how many of you sitting here today are ready to put up your hands to say you've been either affected by or have someone in the family or a friend who has been affected by mental illness? And again, I can't see very much because of the lights, but I don't think there's a hand that's not up. So actually, mental health and illness is universal. I don't know why we don't see it. It's not a crisis. It's in us as well. And the flip side of the crisis is not everyone sitting here has had access to mental health services, which means somebody's managing it every day. And that strength lies in the families, in the teachers, in the schools. And I wonder why we don't look at that. And I wonder why we don't map that and say, well, let's work with that. Because somebody's doing it every day. And we are just saying we don't have manpower. We don't have enough resources. Where there are resources that we are not.
And
So
I want to definitely come to that. And I think the challenges that we face, the sort of hurdles that exist, but also the resilience that exists in our communities that we need to tap into. But I want to take your experiences to Devika. And Devika, I remember the one line that stayed with me in our call was that I don't want anyone to go through what I went through. What inspired you to embark upon your journey with Synchrony, with dance therapy, but also with mental health as a whole?
I think I'll start with my founding member, who's my mother, who very intuitively put me in a lot of art forms very early on in childhood. Maybe because it wasn't that I had too much energy, I still do sometimes, but to just sort of say that, oh, this is where it needs to go. And I was good at academics, which is why it would always be masked, right? Because there is a girl who's getting national awards, but then there is also a girl who doesn't know when to say what, right? So the social cues were always a big question mark, and I lived in a joint family. So it was always like, oh, you're not supposed to say this, you're a girl. These are some of the things that you can say. This is the way you can be. And I think because there was the freedom of the arts, but because I was also good at the work and the study part of it, she read one newspaper thing which said, oh, dance therapy is a thing. And she came to me in 7th grade and she said, Beta, this is what you will become. And I said, okay, Mama, this is what I will become. And that, that belief that maybe this is what I need to be able to choose for my child. And it's not like I come from a Gujarati family. We're supposed to do MBAs and go into business with my father, who's in jewelry business. So that is the career path put for most Gujarati women who are wanting to get into the world of professionals, right? And I kept telling him, I was like, Papa, I want to do dance therapy. I want to do dance therapy. And there's been no psychologist or anybody even remotely close to psychology in our family. Right? So they're like, oh, but we don't have enough network for this. So how will you make money? Right? How will you survive? Or who will marry you? Right? That whole thing that if you work with them, you become them. Right? So that was another thing. I was like, but I'm already them. But that didn't make sense to them, right? So this othering that you keep doing within yourself, where you say this part of me can show up in the home, this part of me can show up in the work. And I think that's where the gratitude comes in, where you say, oh, I had people who said you should go do dance therapy. Right? I had Dr. Beam Singhal, Padma Shri, Dr. Beam Singhal. He's like, you should go, you become dance therapist, come back, open a school, open a company. And my father's like, oh, a doctor said it, a man said it, okay, you go, become a dance therapist, right? And that's where I said, okay, let me do this. Obviously, the journey of it seems very nice and rosy from the other side, that we chose a profession 15 years ago that nobody was choosing. We chose a path within mental health. If you think mental health is marginalized, try being a dance therapist. Yes, we're the bottom rung. Like if nothing works, then they're like, body mein there's a problem, we should go to a dance therapist. Right? But by that time, the body already has accumulated so much that it's very hard to come to, right? So then we have this, so you want to start a company or an organization that does dance therapy, but first get a job and pay your loans. Right? So you're trying to hold a job. If you do masters in a Gujarati family, you're already way too old to get married. So then you have to come back and you're constantly fighting those battles, saying that I've not become who I'm meant to be yet. How can I, go into a partnership and things like that? And then at the same time, you have people, and I think that's what I loved in the book of Homecoming, is that no matter what the struggles, every chapter has named the people who stood by them. And I think I've been very lucky that every single organization that we partnered with in Synchrony, they are still with us 15 years down the line. So they believed in the process, or they might have said, oh, let's give this little Enthu cutlet, like how they say in Bombaya language, she's Enthu cutlet. Let's give her a chance, let's see what happens. And then we had parents and caregivers coming and saying that, oh, we want a full-time dance therapist now. We want you to call her, we want you to get her to come every day. Right? So that's when the organization started saying, oh, what is really happening here? And I think that's when Synchrony really took off, is when the community stood by us, not necessarily the funders who wanted big numbers. And if you're working with the body, you can't work with big numbers as an individual, because as much as I'm working with other people, their bodies also impact my body. Right? So for me to be able to hold that with multiple people, not possible. So I think that faith which a lot of my clients offered, that one moment where they feel alive in their bodies and you're like, oh, remember this. Don't remember everything else, but remember this, right? All of that fed into what we say at Synchrony. If you move bodies, you move minds. And I think that movement became a movement. And today we are global. We are in Rashtrapati Bhavan. We are in Asia Society. We're teaching in like Netherlands, China, everywhere, right? So it's no longer a field which is dominated by white narrative or by Eurocentric knowledge. It's also where Indian people are now getting the chance to go and say, this is our culture, this is how we move, this is how our communities heal. And I think for me, Synchrony is all about the communities that we've managed to create and sustain over a period of 15 years. So I would say I'm grateful, irrespective of whatever has happened. And like I said, I don't want anybody to go through the journey. I have a lot of students here, but I would want them to start where my struggle I don't want them to struggle the same way as I did to set up a grassroots organization. They should be able to build on that work. And that is, I think, what all of us are trying to build in this ecosystem. We don't want another Kavita sitting there and trying to say, oh, this is the gap that exists. Right? I think that is the founding dream. I think to not have somebody go through that again.
And I think that's so powerful, right? And I think, please, we must. And in so many ways, both your journeys are so personal, and they reflect this urge to ensure that nobody has to go through what you went through. It's the little Kavita who should not have to go through what she had to go through if she were going through it today. It's you, Devika, saying that your students should not have to go through this. And you come to this from the perspective of practitioners. And I want to take this question to you, Neha, because I know we started off this conversation with Dr. Godrej also asking that first question, that suddenly the founder of India Art Fair has taken a very, very dramatic turn and worked in a mental health space, which initially is a stigma in and of itself, and taken on a challenge that nobody understands. What is that journey?
It took me also a while to understand. The switch actually was the easiest thing. It was literally, to me, my homecoming. Because mental health has really been what has shaped, or the lack of, has really been what has shaped my entire life. So over the last 4 decades, as a family, we have dealt with 2 generations of severe mental illness. My mother, who suffered a lot for 20 years with the same condition, schizophrenia, who was untreated, undiagnosed for 20 years, spent 10 years of that struggling across the country with my younger brother, is here today to celebrate this particular launch of the book, Homecoming. And so... And so I share that because this is, I think, the first time I've done several of these conversations, but it's the first time that she and my daughter are sitting in front of me. And so it truly is a moment of truth. But for us, because mental health, similar to Kavita, was not really talked about in the 80s and 90s, neighbors didn't know what it was, family members had no idea how to deal with it. Everyone dismissed it as sort of just domestic challenges or marital challenges. Children were sort of hiding under the dining table or running around trying to figure out how to be normal. You know, the whole idea was to fit in. So I remember volunteering with Spick McKay in school, and I remember spending 10 hours on the field playing hockey, badminton, and so I always say sports saved my life. Because those 10 years that I lived without my mother and my younger brother, I just played and until I was ready to crash and end the day. And so it's what kids do, right? You fight, flight, or flee. And so that was the coping mechanism in the 80s and early 90s. I think there came a point somewhere towards the end of my teenage years when I realized that there's no running away from this. And it's going to, it plays catch up, it sits in your body. People develop autoimmune conditions and cancers and diabetes and heart conditions, all sorts of things. And there's mental health challenges as the bedrock of all of that, often. And so there's no running away from it. There's never a good time to get to it. And so as hard and as difficult as those challenges are, the sooner, and this is the early intervention point, right? Firoza, you also mentioned access. The sooner young people and families can reach help, whether it's within their families or in their extended communities, friends, or doctors and therapists, the better it is. We didn't have any such luck. And so I used to write in my diary over my teenage years, someday I will grow up and I will try and tell that doctor uncle how to talk to the children in the waiting room, or I will, make a hospital that looks like this. And we've just set up our first hospital in Bangalore, IMHA. IMHA, which is our mental health organization, is 5 years old, but because of COVID and the severe need, today we reach over 600 cities. We have a hospital in Bangalore, we have centers in Delhi, Bombay, and Bangalore as well. And we see something like 40,000 clients at a time, like in 18 languages. So think about the scale of the problem. This is an organization that is new, and there are several like us now out there. But the kind of reach and the need that people have, this is the demand and supply gap, right? There are, we remember telling our investors, we don't, they said, but nobody really wants mental health things. There's a lot of stigma. So we said, you're talking about a country that has a lot of stigma, but a country also that has 300 million people now with diagnosed mental health conditions. So we only want to treat the people who are already ready and willing to get treated, right? Can we help them at least? And that will automatically open the conversation up. So the big discussion was, are we going to be in a side alley, with a little board that nobody sees so that you can hide and go into a mental health center and hide from society and hide that part of yourself? Or are we going to be on the main road in Bandra and in Indira Nagar and in Delhi with a big board that says, IMHA, your mental health partner, right? And same for Children First. Now we work together, Kavita and myself. So this is really the idea. How do you mainstream it? How do you legitimize it? For these 13-year-olds like my daughter sitting in the room, how do you make it okay across generations to talk about mental health, right? To talk about these diseases and conditions that exist, bipolar disorder, suicidality. I lost my brother to suicide 5 years ago, and it was after we started the mental health journey. And so for me, this is deeply personal. Here is a child who was invisible, who did suffer. Relatively speaking, I had the privilege. I had the privilege of being at home and being in school and having a relatively stable environment, but my brother really didn't. And then today you go to NGOs and organizations across the country, so many people are homeless and are distressed and estranged from their families because of these challenges. So this is the privileged lot, the lot that has the access and the resources and the connections to big cities to call up a doctor and get the help that they need. You can get a psychiatrist on your speed dial and reach out, and this is really what the privilege is. So I just wanted to try and, like everybody else here, just try and make sure that other kids and other families don't go through 20 years of severe trauma, of compounding challenges where access can be provided more easily in a more humane way. A hospital shouldn't be a place where people are chained down to a bed. It should be a place where people can live with dignity, can get the treatment they need, their families can get support. Can doctors and patients and families work together to build collaborative care systems? Can adults and children both get help? Can we think about the whole family? We all know those who have been touched by mental health challenges. It's not a one-off, and it doesn't impact just one person. So you have one person in the family, it impacts everybody else. And so this is really, an opportunity, and Homecoming is an invitation to all of us to say, 11 of us have opened our lives up and talked about our entire journeys and stories in first person to be able to put a name to a face and say, this is my story. Wherever we've launched the book, people have stood up and said, I want to share my story as well. So I just feel, to your point about loneliness, the best thing we can do is hold space for someone's story or share our own, because that really will bring the change. Thank you.
What's standing out to me is both Kavita and you have mentioned that you had this desire to tell the people in the system that this is how you should talk to the person you're treating. You're learning from family members. You're learning in the evenings after your rounds are done. Kavita, what has changed in the last 20 years? What are the challenges that we were facing then? What are the challenges we continue to face today?
How many hours do we have?
All evening the theatre is ours.
I'll try and be short. What's changed is there's a lot more conversation. And I think COVID was one of the factors. And the younger generation has been a pioneer, completely. I think the government of India and everybody else was trying to talk about anti-stigma campaigns for mental health for the last 3-4 decades. The needle did not move. As much as it has moved, at least for the urban on social media population of the younger lot, they own their mental health. The under 30 population right now, between 14 to 30, thank you. You own your mental health challenges. You talk about them. Some people say you talk about it too much, but at least there's conversation. There's conversation, there's owning, it's not just anti-stigma. I think they've taken it completely to the other side, where one of the young people I was working with said, it's cool to do therapy now. It's not stigmatizing. It's cool. And you know what? Out of my 5 friends, I'm the only one who's not in therapy. Doc, can I get a therapist? So, couldn't have imagined this when I started practice.
It's now on dating app bios. Will not date until you're in therapy.
There you go. That has changed.
Yeah.
That is a complete change. Like, in college, I was not talking to my friends about anything to do with mental health, although I was becoming a doctor. It was part of the healthcare system, but no. I think that is a huge change, at least in the urban young population, and I think complete credit to that generation right now. I think they're forcing their parents to talk about it now. It's all out in the open. It's in the movies. There are serials about it. It's beautiful. It doesn't matter what the conversation is. Challenges, we'll talk about later. But that's one of the biggest things that I've had the privilege in my lifetime to witness. People starting to talk about mental health.
And that also presents an opportunity. And I want to take this to you, Neha, because mental health was considered uninvestable, right? It was considered to be a charity conversation. You do not start an IMHA because it is financially viable. You do it because it is something you believe in, but you do it as charity. The growing conversation around mental health has also made mental health a viable sort of enterprise to support. How has that affected your ability to scale? Because the biggest challenge we have right now is scaling this, right? 300 million people now. We can't do that unless we can scale.
Yeah, I think there are many components to building an ecosystem, and there are different funding models that one can look at for different parts of the ecosystem. So I remember my parents were very concerned, you leaving the art fair. I mean, who would leave the art fair? And, you just won this award, and, how are you going to support yourself in mental health? And all of these concerns, very valid. Because at that time, 5 years ago, it really was the case. And when we were, IMHA, we raised the largest check outside of the US and UK for mental health. And the reason we did that was because my belief really was at the time, together with my business partner, that for services, the services model has to be self-sustaining. And so for that, to scale it, to be able to build a multi-level model, right? So we've got inpatient, we've got hospitals, we've got centers, we've got online therapy, and there is a digital platform that reaches about 5 million, 6 million people now. To do all of this under one umbrella platform, you need to have a large amount of capital that is supporting you. On the other hand, there are lots of great experimental initiatives, there are lots of great research oriented projects that organizations are doing across the country, where they're taking community-based models that they're learning from schools, from colleges, from workplaces, from communities of homeless people, all sorts of different models that are emerging across the country. Now, how do you bring those models to light? So that is where the philanthropic approach really plays a vital role, because building knowledge, building an ecosystem, this is what the India Mental Health is standing on. And so then 2 years ago, we set it up as a not-for-profit. And what this does is builds the ecosystemic factors that are needed. That is, before you've reached a scale where government will get interested to fund it, but something that private capital will not touch. So my belief is that I've got 20, 30 years to stay in this space, and so we're just getting started. And so for me, I'm saying, okay, we've got a services organization, you build it, you scale it, you take private capital and do that, because it needs to reach a large number of people, but it needs to provide what is at least the baseline of quality care in this country, right? Never can you dilute or take away from the clinical excellence and from focusing on the person and their family at the center of it. So it should never be about the money. It should never be about scaling at the cost of people, right? It's always humanity first. So I think that's the principle there. The India Mental Health Alliance is on the principle of building the invisible scaffolding that is needed, this ecosystem we talk about, right? How do you bring organizations together with government, together with caregiver movements, together with, we have 275 member organizations. It includes women and child organizations, livelihood, education, because mental health cuts across all of this. And so that's the power of an alliance. And Firoza, you've talked a lot about that, and this idea of building knowledge, building open source knowledge that people can access, and sharing and learning from each other. So that's sort of the second factor. And then the third really is caregiver movements and lived experience movements and groups of people coming together. I'm a part of several of those, and it is so supportive, much like the homecoming journey, when you are just leaning on people who have had similar experiences. And it's like a support group, much like Al-Anon or Alcoholics Anonymous that you have for addiction. So I think these are all different models, but no one model is going to be able to solve for all of it, and no one organization is going to be able to solve for it. So collaboration is the key. Public-private partnerships is the key. Working with caregivers, lived experience people, and psychiatrists is the key. It's got to be about coming together.
And I want to definitely come to the IMHA and the ways in which we come together and the incredible resource hub that you have on your website that brings this data together. But I want to also turn to you, Devika, to ask, what does it mean to build from scratch an ecosystem that doesn't currently exist around dance therapy, right? You're in some ways at the prototype phase of a lot of other movements that have already existed in the mental health space. You just said you're the bottom of the barrel when it comes to the mental health conversation. What does it mean to create these standards of care, to move away from this perception that, oh, dance therapy is what you try out when everything else has failed?
I think for me, and I can only speak for myself in this, is it's always been a multi-pronged approach, like that, that famous saying, we'll come to that challenge when we come, we'll come to the bridge, we'll think about the bridge at that point. So for first, it was just to break all the myths around dance therapy. That was one. The second one was I was trained in the UK, and there were all these things which you were taught, and you come and you do community practice, which is where my heart was at from the beginning, and nothing works. And you're like, oh, so what was that 60 lakh rupees that I spent in all that training for? And it's a piece of paper which says I can be a dance therapist, or I can call myself a dance therapist at best. So you build the system for yourself, right? Then when you build it and people start engaging with it, you're like, oh, I need more physical bodies. Can I clone myself? Because I can't reach that many people, as many as that I would like to reach. So then you go into, okay, let me get started into education. But I cannot educate a whole group of people alone, because there are so many diverse bodies and there are diverse minds. So you start an ecosystem and you bring people together to get into teaching. But when you teach, and there is a government which says, oh, what is this dance therapy? There are no jobs for it. So how do you then train students and then tell them, oh, go out and start from scratch again, right? So we then have to say that, oh, so maybe we need this to get, like, for the government to now recognize it. So then we created an association which is called the Indian Association of Dance Therapy. And then there were a bunch of us who came together, and we're sitting and writing petitions, and we involved everybody. Like my husband was said, "Arey, you know that MP? Let's go. Let's give that MP the petition." So you bring everybody, every Tom, Dick, and Harry who thinks has some clout. You say, "Bhai, kaam kar do nahi." Right? So you come from that. There is no other way but to say that I need you to do this for us. And I think that is the hardest part for people to say, is that I need you. Because we're so taught to fight with all of this yourself. Also that independent feminist movement. No, I'm the Nari, I'm suddenly independent, I have to do everything by myself. So we distance ourselves so much from communities that can potentially help us, because we want to be that independent leader. So I dragged everybody into it. We went, gave, multiple cities, we sent letters to MPs. It then showed up on NCHP, which is the National Commission of Allied Healthcare Professionals Act. But we were clubbed with podiatry, right? What is podiatry? You have feet, dancers dance, same training, right? Same kind of professional licensing. So we said, no, if you don't know what we are, put us in some other category, right? So now we've gone into this other, and I think other is going to be the name of my next company. But we've gone into this other professionals. And in that othering, we found support with IMHA. IMHA was one of our key partners at our first national conference in Delhi, which happened in November. So we then went into policy. We've gone and created these courses which can now be recognized by the government. And the problem still is funding. So I work with marginalized communities, but None of them pay for my fees. My fees are funded by somebody outside who believes, like one person who said, oh, I was an artist, I was a dancer, I think dance therapy is where I want my money to go. Right? So philanthropic capital, right? So I can actually reach those marginalized communities because somebody else is affording me. So I'm not marginalizing my own existence by saying, oh, I'll do everything pro bono, because that is the work, and that's not sustainable, right? I am privileged in a space where today if I don't work, I will be taken care of. Not everybody, not anybody, especially those struggling with mental health, the first thing they lose is their job. Right? So how do mental health professionals then sustain their own lives? Right? So we need an ecosystem that can sustain mental health professionals, dance therapists, all of us work together, right? We're all in the business of or practice of taking care of each other. We are caregivers, right? We're not caretakers. Still in India, we're still caregiving, which is different from the UK or the US model of caretaking. They come in, they do the job, tata bye-bye, the government takes care, the NHS takes care of them. We are still not in those systems, Anish. So then you're working in education, you're sustaining yourself, you're going into communities trying to sustain a community. You're then also fighting for policy at the same time, right? All of this while then somebody coming and telling you that we know who you are and how you should be trained. And then we're like, okay, maybe the commission will then help us create jobs, right? So my goal in life has been this. Every organization that I work for, after 4 to 5 years, I leave that organization and there is a vacancy now which says dance movement therapist. That is how I built it, right? Because you don't want to be the one person and in that one organization. So if you actually look at my week schedule, one day I'm in Mahalakshmi, one day I'm in Bandra, one day I'm in Juhu, one day I'm in Panvel, one day I'm in town. Instead of asking people to come to me, I have gone to the people. Because in Mumbai, there were very few of us who were trained to do it at that level, right? With that same dignity, with that same training. I feel with mental health, at least people are talking. In dance movement therapy or any creative arts therapy, we're working directly with the bodies. So we, in fact, have more responsibility because they're sharing their movement journeys with us with no words. So if we are not trained properly, then we're actually doing them more harm than good. Right? So then it becomes this whole like existential crisis. Am I doing enough? Are we responsible enough? Are we building enough? Are we building fast enough? And like I said, my funding comes from people who've seen the change, who are like, you know what, let this person be funded by me. But then how many of them are going to be funded like that?
And that's, I think, a very, very important intervention, right? And I want to come to both of you for IMHA with that. Will we do more harm than good if we don't have initiatives like IMHA providing, one, some access to all of us as to what the standards of care are across the board that we can successfully replicate, but also what the sort of fountains of knowledge are that we can all draw from that nobody wants to support, right? I mean, we're struggling, right? We're struggling to get therapists to be able to make an honest living. We're also struggling to get clients to be able to afford the fees that a therapist charges, right? In the middle of all of this, why is it so important to create something like IMHA? To be able to sort of navigate these different worlds? And what is the purpose of an organization like IMHA?
I'll start and then you can have the last word. So we both win. Yeah. So I think precisely the kind of things that Devika you're talking about, that when you start off solo as a person or as a singular organization, this is what you face. Similarly, on the other side, somebody who is affected by mental health issues is also alone. So all of us, while doing great work, are alone. We also know everywhere you go in the country or in the world, there are wonderful people with great intention who have done great work, but in that fragment or in that area or in that geography. There's no way to amplify that. There's no way that local wisdom, that contextual wisdom over years can be distributed. So IMHA in that sense is hopes to be a platform which actually catalyzes this, amplifies some of these organizations, for people to see the work that's already being done. And, at the annual convenings, one of the beautiful activities that was done was we had 182 different organizations from the Alliance, from Ladakh, from Manipur, from Tamil Nadu in the same room. And they did an activity where they said, this is what I have to offer as an organization. This is something I can do for you. And this is what I need. Imagine 182 such things that can now be mapped, and they are now helping each other. So IMHA hopes to be this platform which brings through the knowledge, amplifies it. It's almost like saying there's a strength mapping being done. There is stuff that exists. People don't know about it. I don't know what my neighbor is doing. I met two wonderful doctors who are sitting in the audience today. I had no idea they were doing the work that they were doing or had the ideas that they had. We need places where we can convene, where we can collaborate, where we can learn about each other, learn from each other, learn with each other. So IMHA hopes to be that in the mental health landscape. That's the simple way of putting it. We do have capacity building for professionals. That's one of the aims. Oftentimes, what Devika has talked about, or what many psychiatrists and psychologists talk about, is you finish your licensing, MD or whatever, and then you start practicing, and it's a whole different world. So that training does not actually make you ready for the everyday ethical dilemmas of practice. Because the client and the family that's sitting in front of me does not come out of the book at all. They may be saying, I'd like to go to a homeopath alongside what I'm doing with you. Is that okay, doc? How does this interact with each other? That's not what my books told me. My books are based on Western medicine. One of the main questions is, can you tell me how my nutrition impacts this? What should I give my child to eat or not? Well, our books don't tell us that. They tell us about the medication. They tell us about the names of the illnesses. Ethical dilemmas like, should I not talk about this illness at home to my children? My child is 6. I know that my spouse has this illness. How do I make sure that my child is not traumatized? And yet, I'm able to nourish them and nurture them in the absence or the almost absence of one of the parents. I have to be a caregiver to my wife, but I also have to look after my child. So these kind of things we don't learn in our training. So when you are confronted by these things every day, you need help. You don't have peer forums. So again, IMHA hopes to build these kind of capacities, which are after training, real life oriented, and make fellowships or peer forums where people can come together and actually talk about this. So capacity building, not in the way that usually in-person capacity building only is talked about, but this kind of capacity building where we know that there needs to be a ripple effect. You can't depend on a teacher. So much like Devika says here, 5 people should be helping each other. 50 psychiatrists should be able to help each other and talk to each other. So that's capacity building, and then there is the alliance part of the organization, which we talked about, and then I'm going to hand over to Neha to talk about the rest.
And I want you specifically, Neha, to speak about how it's also a reframing towards a sort of developmental issue rather than a sort of health issue. And why it's important to have organizations that are not just mental health organizations, quote unquote, that are part of IMHA.
Absolutely. And I think I'd like to begin by trying to simplify all of this and make the conversation also a little bit more accessible, to say that many of us here are not psychiatrists and psychologists and mental health experts of any sort, like myself, right? But all of us, we all raised our hands, are what we now call, and in this book, lived experience experts, right? So we are the experts of our own lives and how we navigate them and what we have learned in the course of our lives. And we have something to share and offer with others. So at the simplest level, every single alliance member organization, every single psychiatrist who's also had a lived experience, like Kavita here, and all of us have something to offer. I think the first thing I'd like to say is that we have to stop using stigma and lack of funding as the excuse to do something about mental health as a community, because no amount of money is going to be able to solve this problem. Right? It is not, we tend to not address the hardest problem, which is to sort of go into ourselves and really find our challenges and difficulties and deal with them, but also appreciate our own strengths and offer them. Right? And I think that's really the purpose of the Alliance. So for mental health professionals to come together as a community, for psychiatrists, psychologists, allied services to all work together in a multidisciplinary way, for Alliance member organizations, you're working in Jharkhand somewhere, you're working in Odisha somewhere, you're doing great work. Nobody outside your Zilla knows what is the great work you're doing. And somebody else sitting in Ladakh is going to start doing that great work from scratch again, right? Taking another 10 years to get there. So by pooling in knowledge, and this is what we can all do. So I really believe that money will always follow, right? We have to be able to think about what the problem actually is and how to solve for it. And I don't think we're understanding that. So the development issue is because mental health is not a subset of health, right? It is not, the mind and the body sit together, right? And this is mental health is in our body as much as it is in our mind, but it is a biopsychosocial issue, which means it's impacted by our social environment, by our livelihood opportunities, employment, workplaces, our schools and college experiences. It is impacted by our relational health. My relationship with my mother and father and child and brother all have an impact on my mental health, right? And spiritual, absolutely. So all of these dimensions, the first time people have mental health difficulties, they are very likely to go to Art of Living or to go to their faith-based healers or to do some other Reiki and other things that they believe in. Who is to say what is right and wrong, right? So the first thing about centering it as a developmental issue is to say this is not, let's not look at it from a biomedical, certainly not a Western biomedical lens, right? Every country is broken when it comes to mental health, because people are not understanding what the problem is and how to solve for it. You can throw any amount of money at it, without really knowing that, we will keep going round and round in circles, right? So I think the fundamental of it is that the person and their family and carer have to be at the center of it. We have to listen in more than speaking to them or at them, right? Doctors have to look up from their prescription and not spend 3 minutes writing a prescription and just handing it off. They've got to look up, make eye contact, learn a thing or two. And then it's got to be a two-way relationship that is called collaborative care, right? This is what we talk about at CF and at IMHA. And then to be able to build that journey and support the family through their lifetime. Now, all these great ideas that all these Alliance members have, the kind of work that's happening in schools and colleges with young people, community mental health organizations like Salam Balak and others, what are they doing? Can we all learn from this? Can we build a knowledge center where it's open source? A lot of the real research and value, people need to go and sort of pursue knowledge from different Western institutions. A lot of it is sitting behind paywalls. Can we make that accessible? Can we create video recordings of Indian trainers? This is what we have at India Mental Health Alliance. We've got psychiatrists, psychologists, and lived experience experts together creating a video repository of training material, which is actual role plays. If this happens, this is what you can do. And that gives you a real case example. We have a program called the Therapist Compass because you graduate, but you've never seen a client before. You have no idea how to show up in a therapy room. Many people, fortunately or unfortunately, are coming into this space because of their own challenges. And I don't know where people are at in their healing journeys when they are entering this space. So how are we being able to take care of our own sort of wounded inner selves? How are we being able to really apply and learn from what is best practice out there so that we're able to build on each other's strengths? And that's really the sum total of it, right? So can we influence policy? Can we come together? The minute there is a collective, people listen, right? So IMHA today with 275 member organizations from 33 states and union territories, it started 1 year ago. This initiative was just to say, can we come together to build knowledge, to convene, and to find out what we can mutually give and take from each other. That's it. It didn't need any money. It just needed a bunch of people from Mizoram and Ladakh and Orissa to come into the same room. And the kind of cultural exchange that happens when everyone's showing up in their regional attire and really holding with pride where they're coming from, what they bring as learnings, and giving that generously to each other, that is the money we need. That is the currency that is actually going to help us understand the problem, solve for it better, attract the funding that is needed. The philanthropists will come in. The government will waken up.
Exactly,
Yeah,
and I
yeah.
was just going to say, and
Yeah.
it's a beautiful way to shed that loneliness.
Shed that loneliness. And so we've started learning journeys for philanthropists to say, come, look at the work that is happening in mental health. Come, we'll take you to a bunch of organizations, see the kind of work that is happening. They will automatically come in because many of them have also dealt with it, right? If we say this is a problem in every home, then it is in every venture capitalist home, it's in every philanthropist's home, it's in every community worker's home, it's in every school principal's home, right? And every practitioner's home. So if every psychiatrist put a label saying, I'm also a lived experience expert, I would feel a lot better going to that person than to go to somebody who, is just sitting there with a straight face and has only read Western biomedical books. So the idea of IMHA is simple. It's an invitation. Just to say that if you are an organization anywhere in the country of any size and shape, if you're a one-man show or if you're a large organization, can we come together? Can we support each other? Can we learn from each other? It is a community of those organizations that will help the government see that we have to invest in policy, we have to put more money behind this, and it will help other people see that also. And we'll have wisdom from India that can inform the rest of the world also, which is really what the idea is for IMHA, to really showcase the best of what this country has to offer globally in terms of knowledge, centering around lived experience, much like all of you have here today.
And if the IMHA is an invitation to organizations, to collectives working in the mental health space, I think this book, which I think we're all very honored to launch here today, is an invitation to each one of you to embark upon a similar journey, away from loneliness into an acknowledgement of shared experience. And I'll be very honest with you, it's not an easy read. It is difficult, but it is so moving and so powerful. And so, thank you to all three of you for being so generous with your experiences, with your challenges, but with also your dreams today. And I think that this is an invitation to all of you to embark upon this project of dreaming together, of a future where we can have solutions to crises that today seem impossible to solve. And I want you to end on this, Neha, and tell us, and actually you also, Kavita, because you've contributed incredibly deeply and powerfully to this book. What does that process of dreaming look like, and what is that process of imagining a better future when you share these stories with each other feel like?
Do you want to go while I think about what to say?
I think those of us who have had the blessing of trauma have had no choice but to fall apart in a big way and really sort of be forced to take the time to pick up the pieces, pull ourselves together, and somehow make sense of life. For me, I've spent many years trying to be a fly on the wall and be as invisible as possible, hiding from the stigma of mental illness in my family. And so really now it is a non-negotiable to myself to say that this person that I have finally found and made peace with, can I show up as that person wherever I am, regardless of context, regardless of my past, regardless of what the future will be. And if I can just be true, and this is really the invitation, but this is also the essence of the book. Every contributor in this book has gone through extensive interviews with us where we have talked about their journeys, not just their life journeys, but also them looking back at their life in a reflective way, trying to see, okay, what worked, what didn't, what support did I get, what failed me completely. What could doctors do differently? How could hospitals be made differently? How could care systems work in a way that respond to my needs? So people have actually shared that. So it's brilliantly insightful for doctors and for people studying mental health journeys, because they don't get to read first-person narratives like this. But it's also very helpful for other carers and people who are navigating their own journeys. Because, I feel that everybody's just waiting for somebody else to go first. So we've done that today, right? We've gone first. And with this book and many others who have shared stories before us have inspired us to do this today. And so I'm hoping that this is a sort of a movement where we can all go back and in our classrooms, in our boardrooms, and in our dining rooms, can we open up this conversation? Can we hold space for other people? Can we use the arts to hold space? I know that my 10 years in the art world were incredibly therapeutic for me. And it's the time I needed to be far away from the world of mental health and to really grieve and heal and find my own self. But my non-negotiable now is to show up as that person wherever and whenever, and then to build on that. So the dream and the ambition and the motivation comes from that sense of wholeness, of being true to one's, the self that one has now discovered and wants to hold on to. So trying to keep myself intact on this roller coaster of impact and not lose ourselves in purpose, because that's the other thing. We tend to say, okay, now I'm going to lead a life of purpose. I've been through all of these things and now I'm going to solve all these problems and that's what I will do with my life. But to really include oneself in one's own journey of life and also do good along the way. So that's been my experience of the book, and also for some of the other contributors who were not here today, Mrs. Godrej included. It's phenomenal stories. There is a teacher who has shared about her journey. There is an entrepreneur who has shared. There is a trans activist who has shared. And every single account is deeply personal and is very heartfelt and open. But it's really putting it all out there so that it's no holds bar. And I think this is really the time. So to be able to create a culture where we can actually just open up, own our whole truth. There is no need to filter or dilute it down or, minimize, alter, and deny, as they say. Can we just own it all, be our whole selves, and then see what happens and build from there? I think that's, for me, the experience.
Can we own it all, Kavita?
Yes, we will try. So I think for me, when I ask myself the question, why did I agree to be a contributor? I think one of the things is, in retrospect, what it has done for me. I don't think that I hold the illusion that I did it for the world. I think that's secondary. If somebody resonates with the story, that's great. It's opened up a lot of things within me. To be able to tell the story of that child and to be able to own it has been immensely therapeutic for me. It has opened up conversations in my home with my father, with my brother, with my extended family, who were all witness in some part to this. My mother's no more. But it has actually made me far more whole than I was prior to this journey. And I would say, I'll be selfish to say, that's what today has been the one thing that I carry as the most precious because of this book. There are many people who've come back and told me, we've read the story, we've resonated, have come back and talked about their own stories. And I agree with Neha. Telling a story is one of the surest ways of listening to one. And I believe inside all of us, there's a story waiting to be told. And then there's a story that we might need to hear. And we should make space for both. I think this makes space for mine to be told. My version of it to be told. And that's what it has done for me. Thank you.
Once again, thank you for that invitation to share, for that invitation to dream, and above all, that invitation to care. Once again, can we have a loud round of applause for an incredible panel, and what a beautiful conversation.
And a big thank you to you, Anish. Thank you.